Hey, everybody. Welcome to another episode of I
Wonder.
Wednesdays. I'm Dr. Hausmann.
I'm Dr. Gerstberger.
Today, we're going to be talking about styes. What the heck is a stye? That sounds horrible. Should I go to the ER?
Yeah, I mean, they can be pretty painful. I don't know that it needs an ER visit. So a stye is usually an infected oil gland in the eyelid. And how do you get a stye?
Well, right where the eyelids come together, right at the eyelid margin, are the meibomian glands. It's very common for those to get clogged. When they get clogged, fluid will build up inside the eyelid, creating like a bump. When you've got a bump in your eyelid and it doesn't hurt, we call that a chalazion. If that fluid just sits there and doesn't move for a long time, it has a chance to get infected. Then it's going to be sensitive to the touch. We call that a hordeolum.
And a hordeolum is the real name for a stye. What would we treat a stye with?
The first line of treatment is going to be a hot compress right there. The heat is going to help to loosen up that fluid. After a hot compress, you want to do an eyelid massage. After that fluid gets kind of loosened up a little bit, the eyelid massage helps to express that fluid out of there and get it flowing a little better. So that's the first line of treatment.
Yeah, and hot compress is a good thing to kind of stop on for a second, because when I tell patients to do it, I want heat, but I want a little bit of pressure, because the heat and pressure combined are what kind of give us that ability to get that fluid out of the way. Once that fluid's out of the way, new fresh oil can flow through those glands and can help rinse out all of the infection. It can also kind of help make your tears better. That's what that oil is designed to do. The second thing that we would do is, if that's not working, we can put you on an oral antibiotic. And we have a lot of people that'll come in and they'll say, I got these drops from my regular doctor and they're not working. Well, it's really hard to get an eye drop into that infected gland. You can't, without injecting it directly into the gland, you can't really get that in there. And it's a tight bubble of fluid, so it's got a lot of pressure out, but not much can get in there. So the way we get around that is we prescribe an oral antibiotic. I like Keflex, doxycycline's one.
Azithromycin, a Z-Pak.
Z-Paks are good. But what we're doing is we're actually attacking that bacteria, calming the infection. And when the inflammation goes down, we're going to continue doing those hot compresses and things like that to release that fluid. It's
tough, I would say, too, back to the hot compress. It's tough to do a good hot compress. We sell masks, eye masks, that are specifically designed for a hot compress, because you're going to want to have it as hot as you can stand it for at least 10 minutes, as hot as you can stand it, without burning yourself, of course, to get a really good hot compress. If you just have a washcloth, that's not going to do it. You need something more. So
yeah, and the ones that we have an elastic band that gives you that pressure, that makes that heat go a little deeper into the tissue and gives you that pressure to kind of express that that fluid that's stuck in that gland. So now you know everything you need to know about styes. Like and subscribe. We're on
Facebook,
YouTube,
Instagram,
anywhere you want to find us.
Yeah. Thanks, guys.